Well, hi there. I'm going to go over the anti-inflammatory section. I'm going to talk about aspirin, acetaminophen, which that's generic for Tylenol, and NSAIDs in general, which ibuprofen is in this. So I want you to look at this picture first. I'm going to go over a couple pictures just so you kind of understand where these side effects are coming from because of what's going on in the body. So I'm just going to circle a couple things. But what happens is there's a long cascade of reactions that happen. But we have this arachidonic acid, which I'm probably saying it wrong. But anyways, it's broken down into what's called COX-1 and COX-2 cyclooxygenase, which is the name for it. That ends up releasing prostaglandins. And that's when you see these prostaglandins here. And this is prostaglandin. And over here is thromboxane A2. So let's go down each side. So if you have COX-1 and you have COX-2 inhibitors, I think of it as a long line. So you have COX-1 over here and you have COX-2 over here, and in the middle is a little bit in between. And the next slide will show you, and I hope you'll understand more. These are each of the benefits, I should say, or effects that the COX-1 has, as well as COX-1 and COX-2. So if we're over here on the left, purely COX-1 has an effect on the GI mucosa. It actually protects the stomach, so it increases mucus secretion, bicarb, and just the blood flow in general. So if you take a COX-1 inhibitor, which is an aspirin, is a COX-1 inhibitor solely, and ibuprofen is right sort of in the middle of here, so you have some of the COX-1 effects. If you inhibit that, you're going to decrease the secretion in the stomach, decrease the bicarb and blood flow. So that's why people that are on COX-1 inhibitors for long periods of time, they are at risk for GI bleeding and ulcers and erosion of the stomach because they don't have that gastric protection or it's much decreased. All right, so let's go to the kidney. Kidneys are affected by COX-1 and COX-2. They have the cyclooxygenase, and that ends up causing, it's a good thing, it causes vasodilation, which keeps the blood flowing through the way it should and increases your filtration rate of your kidneys, increases your sodium and water excretion, so that's good. So what if you inhibit it? Well, there's that chance of having sodium and water retention, then high blood pressure, and acute kidney injury. So I know I had talked about at one point is people that are taking NSAIDs for long periods of time, and they're really not meant to be taken long periods. It can have an effect on the kidneys, and this is why, because you're blocking that specific COX-1 and COX-2. And then we have COX-1 and 2 for cardiovascular effects. So we look at the prostaglandin, and now we have thromboxane A2, which has vascular effects. So it causes vasodilation. It helps so your platelets don't aggregate together. It keeps your blood flowing very well. And so that's vascular. Now your platelets, that's what COX-2 does. All right, so COX-1 and the thromboxane A2 actually blocks or it clots your blood, and it also constricts your vessels. So you can see COX-2 and COX-1 do different things. So COX-2 is greater than COX-1 inhibition. And so if you're going to block, think about what happens if you block this COX-2. You're going to have vasoconstriction, and you're going to have blood clotting. So a example would be Celebrex is solely a COX-2 inhibitor. Now with your platelets, which is aspirin, if you we take aspirin to actually thin the blood. So platelets, as I said over here, it's a COX-1, so it has an effect here. It has an effect here, it has an effect here, but really it's going to affect the COX-1 because it's solely a COX-1 inhibitor. whereas Celebrex is a COX-2 inhibitor, and ibuprofen, indomethacin, and there's a whole list of them that are right in between, right in the middle of the line. So just understand that COX-1 can have effects on your GI mucosa, kidneys, cardiovascular. So if you inhibit it, it's going to do the opposite. And then COX-2 does not affect the GI mucosa, but it still affects the kidneys, and it will affect your vascular status. Okay, so I hope that helps. Now let's look at this table. So if you can see, here's COX-1. Oops, it left me here, the pink. Okay. Here's COX-1 over here, and then here's COX-2 over here. As you can see, COX-2 is here too, actually. Here's your Celebrex, meloxicam, diclofenac. These are really popular ones. I don't see that too much. I've never prescribed these before. These are the most common ones that are prescribed out in the market. Again, you don't have to know these, but I just want you to understand that there are COX-1 specifically, and there are COX-2, and then there's some in the middle. So if you are taking aspirin, which is over here, ASA is another name or another abbreviation we write for aspirin, so you'll see that quite a bit. Aspirin is solely a COX-1 inhibitor, which is why we have to be careful with GI effects, because remember, it affects the GI mucosa. But it doesn't affect cardiovascular issues as much because it doesn't hit the COX-2. So it doesn't have that. It actually has some protective benefits for your cardiovascular system. Because right here, COX-1 actually clots your blood, and if you're taking a COX-1 inhibitor like aspirin, it's going to thin your blood, so it's cardioprotective. We have ibuprofen here, which is the one you have to know about. It's a COX-1 and 2 inhibitor. So this is just to give you an idea. COX-1, you have more GI effects, and COX-2, you have more cardiovascular risks. So remember, if you're on Celebrex, these COX-2, if you go back to this slide and you inhibit it, you can have vasoconstriction and you actually have blood clotting. And so that's why people that take Celebrex or diclofenac have a higher risk for MI. And so I'm watching more for that than I am for GI stuff. Whereas ibuprofen, I'm watching for both, and aspirin definitely for GI effects and kidneys within here too. Okay, so that's that. So let's go back to what I wanted to start on here. Okay, so now we're going to talk about salicylates. What are those? That is your aspirin. All right, aspirin blocks the inflammatory response. All these are anti-inflammatories, except acetaminophen doesn't work as much as an anti-inflammatory, and I'll go on to that next. It's not in the NSAID class. So we'll talk about aspirin. It blocks the inflammatory response because that's prostaglandins. If we go back to this slide here, we have prostaglandins, and prostaglandins are have to do with inflammation. And so if you have, like, let's say a cut or something wrong, then it can release prostaglandin, that's your body's mechanism, and cause inflammation. And so these also work as anti-inflammatories. Okay. And if you see here, these are some common salicylates, although aspirin is the only one that you'll probably see. Sometimes mesalamine will be given because it's given for patients with like Crohn's disease and ulcerative colitis. The other ones you probably will not really see. It's very rare, but aspirin is used. It's used to treat, usually it's given as a baby aspirin to help prevent clotting in the arteries and help reduce the of heart attack. And it's usually older people that take that and are at risk for that. Like if you're diabetic and you're over a certain age, then it's indicated. It also helps with pain, and it also reduces fever. It used to be given all the time before NSAIDs became popular, and Tylenol. So moving on here, it's metabolized in the liver, excreted in the urine. It's absorbed from the stomach. So it inhibits the synthesis of prostaglandin. It's used to treat mild to moderate fever. The one thing we have to really watch out for are bleeding issues, because remember we talked about that decrease in gastric mucosa. So a GI bleed is really, it's actually, I've seen a lot of people with GI bleed because they don't take it like they should, or they're overtaking it, because again, it's over the counter and they think it's safe, but it's not. It's anything over the counter can be serious if not taken correctly. Also, Alka-Seltzer has aspirin in it. Pepto-Bismol has aspirin or salicylates in it. So there's other things. That's why it's important to read the ingredients. All right, so what are some GI bleed symptoms? Well, think about if you're losing blood. You're going to be fatigued. You're going to feel dizzy. You could lose consciousness. You could or have stools that have blood in it. Now, usually the stools have more maroon color or darker blood because GI bleeds from NSAIDs usually happen in the gastric area. So think about this. If you're bleeding in the stomach, it needs to go through your digestive tract in your duodenum, small intestine, large intestine, and by the time it gets out, it's more of a darker color. Whereas if it's right towards the exit, like people that have diverticulitis or diverticulosis, that is in the lower left part of your colon, that's right by the rectal area and by the exit, I say. So it's going to be more bright red blood if it's bleeding from there. So you always have to watch out for that, as well as kidney issues. The other thing that is very important, Ray's syndrome in kids. That's why aspirin's not given. My mom used to give me aspirin all the time. I remember she would crush it and put a little water in it with some sugar and a teaspoon, and that's how I'd take it. But they found that these, with viral illnesses, kids got this Ray's syndrome, which can be deadly. So we don't really give aspirin in kids anymore. Now, NSAIDs. You don't have to know this NSAID list, but I want you to see how many NSAIDs are out on the market. There's a lot, and if we see the COX-1 versus COX-2, most of these are just stuck right in the middle, whereas we have some over in COX-2, and then some over in COX-1. Like that's COX-2, that's COX-1. Most of these are COX-1 and 2. They're anti-inflammatories. A couple of these are over the counter. Like naproxen is a leave, aspirin's over the counter, ibuprofen's over the counter, and I think that's it. The rest is prescription. Sold over the counter, which may lead to abuse, meaning that people are taking it too much, which happens a lot. Let's say you have migraine headaches. Some people can take that too much and have those side effects. NSAIDs reduce fever, pain, and reduce inflammation. The main things that I want you to be aware of are adverse effects. You can have issues with GI, so think GI issues, GI bleeding, also kidney issues, because remember that that slide that we saw, you can have kidney issues if you're blocking that COX cyclooxygenase. And then dosing has to be really careful. You have to be really careful with dosing and making sure that they're taking it correctly. They're not overdosing on it, because then that's poisoning. So if you overdose on anything, it may be intentional, may be unintentional. That's poisonous for your body, right? It's too much. You want to make sure that you're taking the correct dosing. Now, if you're only taking half of the dose, you're not going to be reaching at therapeutic level. Remember, we talked about therapeutic level. All All right, and I think that's all I'm going to focus on that. Now let's go to Tylenol. Now Tylenol is a little bit different, and really we don't really know why it has the action it has. It works with the thermoregulatory cells in the hypothalamus, and it is a fever reducer. It reduces pain. It doesn't really work as an anti-inflammatory though. What also sets acetaminophen apart is liver toxicity. And so that's why I made an arrow here. So really pay attention. This is where it's working. And hepatotoxicity. I actually had my friend's mother who passed away. She was an alcoholic and she took Tylenol and she died. And I've heard of this in my career of nursing, of this happening. So as you can see, you don't want to take Tylenol with alcohol. You don't want to drink too much alcohol and take Tylenol. It's just a bad combination because it really is hepatotoxic. It can cause many other things, but it's dangerous to overdose or take too much of Tylenol because you can die of liver failure and you cannot live without your liver, right? All right, I think that's it for that. Now remember, this is a category A, so it's safe for pregnancy, but again, we don't want to overdo anything. It can be hepatotoxic. Whereas when you think of the NSAIDs, think of more kidney issues. Okay, so just a few points that I wrote down. Safety is number one. And so if you see an exam question, remember, always think like safety. So if there's a question that's like, what's the priority? You want to think, all right, what choice here is like meaning I'm making sure my patient is safe. You want to give every drug that we give, we want to make sure it causes minimal harm, but yet gives them maximum benefit. What if a patient's on multiple drugs? Anytime you take a good history and the patient's on drugs, that sounds horrible. Anyways, all right, hope you got a laugh from that. This patient's on a lot of drugs, you want to check your drug book, right? Because you want to look these up and see if there are any interactions. And I know that I really promote Hippocrates because it also has an interaction checker on there for free. And so I can put in like 20 different medications and it'll tell me exactly which ones have an interaction and what I should watch for. I use it all the time in my office. So to go back to the safety issue, you have to make sure that we're maintaining the patient's safety during any time we're giving medications. Also, I want to shift gears a little bit. Child dosing. How are you going to give a child Tylenol? Well, for those of you that have children, you probably know you go by weight. So you look on the back of the bottle and like if they're under like a certain age, they'll say consult your doctor. But if you get like infant drops, it will give you, it's more weight based. For Tylenol, ibuprofen. So all medications are weight based for children. If I need to give an antibiotic, I actually look it up and it'll say 90 milligrams per kilogram divided up into 3 doses. So just so you know, that's how we determine is child's dosing. There are some with adults that we do need to use weight and body surface area. For example, chemotherapy drugs, we do that. You don't have to know that, but just a little tidbit that, yeah, there are some drugs that we do by weight as adults, but it's usually anti-neoplastic medications. Make sure when you're asking patients their history, we talked about this the other day, is are you taking anything else? Remember to ask them outright, are you taking herbal supplements? Are you taking over-the-counter, such as Tylenol, ibuprofen? The more detailed you are, the better. We don't want medication errors to happen. So what is considered a patient medication error? Make sure you review your rights to giving medications, okay? Right time, right dose, etc. So make sure you go over those. But some things that I want you to be aware of Med errors are when you're working as a nurse and it says a dose is due at 9 o'clock in the morning, then you only have like an hour window to give it. So if it's due at 9 a.m., you have like that 8:30 to 9:30 to give it. If it's not, it's considered late, and then it's a med error. So that's a med error by giving it late. Sorry, my handwriting's horrible. Another thing would be, let's just say the doctor comes in and he's like, you know what, this patient doesn't need this. He puts it into the system, and then the next day you give it. And you're like, shoot, it was discontinued yesterday. Well, that's a med error too. Anything that is not supposed to be is a med error. If you left something out and didn't put it back in the drawer and it's supposed to be like refrigerated, then that is a med error. Or if you just give something, because remember there's as needed medication orders you're going to see. It's going to be PRN equals as needed. Many pain medications are ordered as needed. And when you see that, you don't give it unless the patient requests it. Of course, you're going to do your pain assessment, and they're like, yeah, I'm in a lot of pain. You can ask them if they would want some pain medication. I could say, oh, I do have ibuprofen on here ordered, or morphine on here ordered. Yes, they have to tell you that they want it. You just don't go and give it. And if you do without them saying or giving you the okay, then that's a med error again. Okay, so I know I'm kind of skipping around, but I want to make sure that I'm covering everything because I know you guys want to do well on the exam too. So let's go back to acetaminophen. We talked about hepatotoxicity. Think about what the liver does. It produces bilirubin. It makes albumin. It helps digest food. It helps metabolize. It helps with glucose metabolism, blood clotting. So it does a lot of things. So think about if your liver is inflamed or it's not working very well. And if they have liver issues, you can have pain in that area. But one thing, if that happens, your liver enzymes are going to go up because it's not producing or it's not functioning adequately. So then it spills out into the bloodstream. And one of those is bilirubin. Bilirubin causes yellowing. So you can have yellow skin, yellow sclera, and that is a sign of liver toxicity or something is really going on. It's called jaundice. When babies are born, sometimes it's very common for them to be jaundiced and they have to go under the bilirubin lights for a few hours or a couple days. It just depends, and waiting for that to come down. Well, if you're an adult and have liver issues, you can have jaundice. Okay, and that is all I'm going to talk about on this slide set here.